Well, I first met Pastor Duncans here at this center, Pleasant Street. I met him and his staff when I came in and signed up for the program, and everything started from there.
Our hope has been with this program from the inception that we can contribute towards each participant's quality of life.
You are the community health workers. They're the ones that are making this thing work.
Being able to expose people in our community to the better option. Them having an opportunity to come into the space and be like, oh, I seen this, but I didn't pick it up because of the cost.
Coming to this program, you'll learn how to eat properly or more healthy, and you'll also learn the things that you have to do to empower your body, to keep your energy flowing.
I love partnership. We're stronger together.
Good day, everyone. Welcome to Pleasant Street Civil Rights and Cultural Arts Center. We're here to continue the podcast on Dr. P on the Pod about Healthy Churches 2030. That podcast was initially focused on really showing what the faith leaders can do to galvanize their community to help improve the lives of everyone in their community. And we're joined today by none other than my very good friend, Pastor Duncan and Miss Patty, to continue that dialogue. As you can see behind us, in this location, this part of the Food in Medicine program, and we're so pleased to be here in the community to share what's happening in this community to the rest of the faith leaders. I think I'll start first by really mentioning why I'm here representing Amgen. Amgen is a biopharmaceutical company with a simple mission to serve patients and improve the lives of patients. And we do that by discovering, developing, and delivering medicines for hard-to-treat conditions, some of which include cancer and diseases of the heart. And to do that, we actually make sure that we develop the medicine to include the people that would intend to benefit from this medicine. And part of that actually is working with partners like Pastor Duncan, leaders within the community to involve the community in that process. The role I do at Amgen is in a team called Representation in Research. And through that work, that's how we came in contact with Pastor Duncan. So I think I'm here now to really share a brief few things with Amgen's work. As we develop these medicines, we've recognized that it takes more than these innovative therapies, innovative medicines to improve the lives of patients. It also takes work. These patients are humans with multiple other things going on, and what we call the social determinants or social elements of health, that's also important to be addressed to ensure that their lives are improved so that we can fulfill our mission. We started this challenge last year in 2023 called Health Equity Challenge in the state of Florida. And that Health Equity Challenge had three components of it: to address the gaps in heart disease in Florida, and to do that, secondly, by working with community-based health workers through navigation, and then thirdly, by actually activating the community to take action to improve their health. So, and that's how we got to get Pleasant Street Civil Rights and Cultural Arts Centers as one of the recipients of that Health Equity Challenge, led us now to be here to continue that dialogue. So I think the work we do, trying to get closer to the community, it's a very unique moment now where I'm in the community with Pastor Duncan to actually firsthand experience what's going on. So I'm excited to also invite Pastor Duncan to share more about the program, and also Ms. Hattie as a beneficiary of the program to share her experiences. So maybe with that, then I'll start with you, Pastor Duncan. Maybe from the current program, can you tell us then the program at the Pleasant Street Civil Rights and Cultural Arts Center? Can you tell us what the program entails overall?
First of all, Jude, I just want to thank you, and I want to thank the Amgen team, staff. It's been a blessing for us to have such an amazing organizations such as Amgen to support our project here in Gainesville, Florida. And so for us, for me as a pastor, it is a moral responsibility to not only empower people in the word, but also to look at their overall health as it relates to their well-being. And so with the Amgen support through the Health Equity Challenge, it's closing the circle with a Black-led health equity nutritional intervention. And so that project itself, it came to be based upon the work that we've been doing in the community, specifically in areas that are, marginalized through health disparities and inequities. And we wanted to create something that was sustainable. I looked at a lot of the work that I had been doing, working with healthcare organizations and working with, College of Medicines and different departments within academia. And I recognized that there was a lot of transactional approaches that was happening. And I understood the importance of relational. And so through the call of action, because it was a call to action by Amgen, we wanted to create a program that really focused on the overall well-being and health of one of the most marginalized, impacted areas of our community where CVD-related and cancer burden existed. Our program really wanted to focus as well on providing the nutritional intervention of food as medicine, because we believe that the food is actually the medicine that our community needs and our patients need. And so utilizing that helped us to be able to implement this food as medicine program as a pillar in the community.
Part of our Food as Medicine program, we have a Health and Wellness Center, which is a resource center where we are providing more information that is centered around social determinant of health, because we recognize that CVD or cardiovascular diseases, it's a major component of someone's health, but also how they navigate other resources that impact their quality of life. So, and here is where we actually we do our studies, our testing here. We provide A1C testing and LDL testing here. We want to make sure that every participant understands the importance of the education that we're providing for them, but also we want to help them to understand how to be able to look at their LDLs and their A1Cs as well. We hope that this is something that they could become more independent in their health, and have like home kits as well. So if they could do it at home, then it even contributes towards, them understanding exactly how this is being done. These are our main topics that we're teaching them. Wow. This is what we're teaching. This is what they're learning. This is some of the activities. So it's important that there's a level of engagement, because people have to want to invest in their health. When we started the program, this program was actually centered around what they wanted to see. What were some of the activities that would contribute to motivating you to want to be healthy? This is what they said. It's peer support, right? And so when you have a small group size, it contributes towards everyone feeling comfortable. They're sharing their experiences, they're sharing their cooking and everything related to keeping them encouraged, right? These are the types of meals that we want to provide. And for some of our participants, it's portional. That helps.
So the portion is controlled.
The portion is controlled. So you don't have to be preparing this large meal. It's proportional, because that's another part of the discipline of your dietary needs, is ensuring that you're eating healthy, but also you're eating it in portions.
That was a vision. Now it's a reality. I mean, I'm so impressed. And most importantly, thank you for you and your community, the trust that they have and believe in you to take these ideas and make it into action.
My name is Hattie Martin. and I'm married, and I'm the mother of 5 sons. Good, 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 good. And I'm a member of the Pleasant Street Center. I know y'all gonna cut it and stick it and put it until y'all get it right. The center has really helped me to understand the healthy lifestyle. It helped me to understand being more healthier and eating better will make me better.
Miss Hattie, can you tell us, how did you get to hear about this program?
I saw a flyer, at least it was handed to me, and I accepted the flyer and I did what the flyer, the instruction that was on the flyer, and I came to this building. And when I came here, I met Mr. Duncans and his staff that was here, and and joined the program.
So can you tell us, how has the program impacted you so far?
Well, it has really, I would say, my health, my health-wise, because I would get up in the morning and just go do my daily chores, and I didn't think about eating until maybe 12 or after. And after coming to this program and listening to the importance of food, how food can really, when you eat it right, how it can really heal the body. It can help heal you. And I started to eating breakfast and drinking my hot lemon water in the morning, and it started making me feel much better, because before, I just, I was kind of slummy.
So maybe if I may ask one more question, what particular services from the Pleasant Street Civil Rights and Cultural Arts Center are you benefiting from? Can you tell us that?
Yes, the education part of what food can do for the body, and how reading the labels on your food, while you're shopping, how that can help you also make the right choices, and making sure you stay in touch with your doctor and ask questions that you wouldn't normally ask, and you think about them, but you didn't ask about them. So now I have been encouraged to ask those questions. You have that right to ask and to receive that answer. And then they also show us how to prepare certain foods that we have been eating all along. So instead of filling your food up with a lot of fats and oil and all butter and all of that, they show us how to prepare it and it be more healthy for us. So, and I also learned that exercise, get out and move around, join the gym while you're able to move. And I did that.
Oh, thank you. That's important. So maybe one other question there, we can go back to Pastor Duncan. Can you tell us about the staff of the program? Can you tell us anything, the staffing of the...
the staffing? Yeah. Oh, the staffing is, I would say, is very good, because about my second day, I think I came here, I met one of his staff, and she showed us how to take the food that we wouldn't normally eat, like celery, sit down and eat a stalk of celery. No, make you some juice, make juice out of it, put a little apple in there, and you'll be able to sit down and drink it. And so they have really impacted me to change certain foods. I learned how to juice it. I didn't have a juicer. Now I own a juicer.
That's good to know. Thank you, Ms. Hattie, for sharing that. I think we may come back to you again. If I can first talk a little bit about, the process that we do in developing the medicines involves research. A research to really confirm that this medicine does work and will do what we intend it to do when it's approved and is out there in the public. So part of the work we do as Amgen, as I mentioned, part of the team I work with, representation in clinical research, we ensure that we include everyone that is suffering from the disease in that process, the research process of developing the medicine. And when we do that, we partner We need partners like Pastor Duncan. We need partners in the health systems. We need partners in the community. We need partners in the medical community as well. So a lot of work we do has to do with partnership for the Black community with the Black physicians, like the National Medical Association, the Association of Black Cardiologists. We partner with them. So we have a study or a clinical research study going on called African American Heart Study, which we're partnering with the Association of Black Cardiologists to study the impact or the effect of this marker Lp(a), almost similar to bad cholesterol, but it has a negative impact on the heart. So we're partnering with these organizations to actually help find and identify people from the Black community who would benefit from this research. Maybe Pastor Duncan, coming to you in your work, can you tell us more about any contributions you and your program have done to research?
We're currently right now, again, we're community-led and community-centered. And, the work that I had been doing with researchers for such a long time gave me the knowledge to really understand the value of research, specifically as it relates to, cancer and certain types of rare diseases that exist within our community. But there had been a lack of access to information about research, right? And so for us, I wanted any research that will be done, it will be done from us. We want to research our own program. We want to control how our program is being presented in the light of, best practices, right? We want to show the evidence. And so I believe that, we can tell our own story, right? And in telling our story, we want to put it out there first and be the first beneficiaries of our program, because we believe that, by having something such as unique as our program, by putting it out and doing our own research and collaborating with others, like, for example, we are looking at, IRBs, those are things that we believe that are beneficial. But I only say that because I just feel strongly about our program. And I feel like, with everything that we've gone through and the relationships that we build, we want to be very protective of our research, right? So we're not just going to expose anybody into our programs or even to the community overall as a whole. And I hold that dear, even though I know the importance of research, I think it is very valuable. And so for us, there are several researchers that have come in, and, I'm currently right now even looking at, with the University of Florida, how do we help provide, culturally sensitive training for research amongst, African-American populations, because I think, we gather a lot of data, a lot of information, but what happens after someone is registered in a clinical trial? What's the follow-up? What's the continuum of care? So we want to go beyond that, especially as it relates to biomarkers. Does our participant qualify for biomarker, testing, right? And so those are things that I always look at when it comes to research. But yes, we are open. Matter of fact, in our program, we are, or I have done some clinical navigation, because we recognize that there are some of our participants that have had some conditions that, we're not able to support them with. But we have different options of researchers that are doing clinical studies that we're able to refer them to. So we're definitely, working with researchers, and we value that. I think a lot of more education has to go into it. And also, I think, what research, how that research is being used, and how that research being reciprocal,
Great, thank you. I think next door I noticed I was very excited to see the point of care A1C test. You could know your A1C on the spot. I mean, I froze for a second when I saw that, and I was very aware of LDL test or cholesterol test, but having A1C is really important. And you mentioned the biomarkers, and being able to refer, people from the community to research is an important aspect. I think maybe one more question to you, Pastor Duncan, regarding maybe partnerships. You can tell us more about other organizations that are partnering with you, that this support has galvanized to help you identify. I think you mentioned another like grocery stores or things like that. Tell us more about the other partners that are now coming in.
Yeah, I love partnerships. It's we're stronger together, right, for our community. And so when we look at community, we're not just looking at this space, but we're looking at banks. We're looking at school. We're actually former school building. Like this used to be the school board administrative building. That's a major partner who says, hey, look, we want to support you. We'll give you space. Some of our other partners that allows us to really be able to maintain a food as medicine program, which contributes to our sustainability, is Feeding Florida, Feeding Northeast Florida, and Bread of the Mighty Food Bank. And so we have a continued food source of healthy foods that we can provide, because the food is the medicine, and that's how we measure, our outcomes based upon the produce. So we're not doing sweets and any of that other stuff, right? We're doing the produce. So we have to have that sustainable source, because also the food also is the engagement, because we are in a food desert. And there are many families that are food insecure as well. But more or less, even healthy food is hard for some of our participants to be able to reach. So having Whole Foods, having Feeding Northeast Florida, Feeding Florida, and the Bread on the Mighty Food Bank, but also having the University of Florida. Like that's our major partner, is the University of Florida, where the clinics are actually doing the referrals through Epic system. They can identify patients who have CVD or cancer related, burdens, and they refer them to us because we provide that continuum of care. So really having that healthcare partner and having a mobile outreach clinic that also just recently did the training. Yeah. They did the training for our community health workers and taught them how to use the A1Cs and how to do lipids, but also having churches. We have churches in our community. We just created an initiative called Impact Duval, where we're now looking at how do we implement more churches into this mix. And just recently, there was a health fair that I helped organize, and we were able to bring our produce, healthy food as medicine program to the church. And we were able to share with them, hey, look, every church should have this program. This is not just something that I want to do. Matter of fact, I often say, well, work me out of a job. Maybe I could travel around the country and create a model if someone else picks this up, right? And that's what we want. So we have all these departments. We have the Department of Health also. We have our fire rescue department. We have our mobile stroke unit. So we have so many different partners, overwhelming partners. And of course, our major partner is Amgen.
Oh, thank you. But thank you for actually tying it back to the Healthy Churches 2030 initiative. Yeah. That's the reason why we're really here, continuing this dialogue. I think maybe I would go with the questions for call to action. But before I do that, maybe I want to go back to you, Ms. Hardy, and say, as a community member, is there anything you can say that could help other members of the community to go through what you're going through with the benefits?
I would encourage them to come to the program and try it, because I believe they will like the program because of the education part. So the program really helps us.
Wow. Thanks. You're very empowered. That's the word I can take out of this. An empowered community member taking charge of their health. Yes. Right. So
it empowers you to really take a good look at your own health. And I believe that others, when I talk to them, that's what I tell them, you need to come and, and join the program. It will help you. It will help you to stay active. because as we grow older, we become very sluggish. I don't feel like going outside today. It's hot. The pollen is high. We find all kind of excuses. But when you get into that program, you'll see that, well, the pollen is high, but the gym is open. and you can go straight from your car to the gym. And there's so many things in there that you can do, because keeping the body moving is also very healthy for us as we grow older. And I appreciate Pastor Duncans and his staff, how they have empowered me to. And once I get empowered, I can go and speak it to somebody else.
When we talk about stakeholder partners and people that play a major role, our local farmers play a major role in what we want to offer at the food pharmacy. Having a space for our community to come and gather and have important conversations, to participate in cooking healthy foods and be able to digest those foods together as a collective. To see them show interest, one, like there's a desire there, outside of, people thinking that within our community we don't like these kind of foods. So to see their actual interest in these foods, like I love it. And then to get into the conversation around the benefits of those foods, it creates community.
So I think maybe, Pastor Duncan, one more question before we go to call to action.
Yes.
Can you tell us you've told us about a lot of successes, great successes in the community, the healthcare system, and even at the legislature. Can you tell us then about challenges? What challenges are you facing, and what maybe else would you need to really maintain or take this even to another level?
Well, I think one of the main things, even before, we came into, receiving the support that we received from Amgen, I was out to do this, as a volunteer. Like, I wanted to do this. And if I could just get personal for a moment, I lost my dad, passed away from a stroke 14 years ago, Mother's Day. And then I lost my mother-in-law to diabetes 8 months ago. And just last week, I lost my mom to a stroke. So, for me, I look at, what can I continue to do in order to be able to help others, right? So this is my passion. This is something that now I've taken on. So the greatest challenge for us is having 2 staff members who've never in their life ever imagined doing anything like this, had no background, had nothing of this, but yet was able to respond, to my call to be able to say, hey, you'll be a good community health worker. Let me train you. And so now they went from community health workers with no training, and they're running this program. I tell them all the time, I'm always walking over them, looking over them, saying, you got to do this, do this. But we are overwhelmed in our capacity, and our waiting list is just overwhelming. So we can't help everybody because we just don't have the means, but yet we still can feed you. We can give you healthy food, but we can't provide, as Ms. Hattie just said, that class experience. We can't provide that for you because we just don't have the staff to be able to do it. Knowing that is challenging, because when I look at my 2 staff members who are only like 8 months in this, and they have to do everything, and then they got to input data, and then they got to do quality control and all these things, it's just hard. Mm-hmm. And so I think for us, not being able to have the staff to increase our capacity, and Miss Hattie's going to be graduating, so we're going to ask her to be our ambassador. So we're going to add to that. We got some ambassadors, but that's the challenge for us, that we can't help people. We have veterans in our programs. We can't help our veterans. Right. So we're looking at what can we do with the limited amount of resources. We got the food, but if we don't have the bodies to be able to give you the food, then we don't want the food to go bad, right? So we're trying to get this out in a way to where we can do it and build on that. 50 in the program, 37 to graduate, 100 people on the waiting list. What do you do with all? There's nothing else like this, So we have to either duplicate ourselves, increase our capacity, or, we won't be able to continue doing the work that we're doing.
we hope some help comes. Thank you for sharing, and our sincere condolences for the recent passing of your mom.
Thank you.
Wishing you well and your family. I think maybe, Pastor, we'll go back again to you with maybe a call to action. What 3 things can you maybe share to help empower other faith leaders like you that they can do for their community?
Yes. First of all, I'll look at this. The third book of John, the Beloved, chapter 2, talks about, beloved above all things, that you will be in good health, and you will prosper and be in good health, even as your soul prospers. So most importantly for faith leaders, we know we have a charge, because health is a major component of the work that we do to ensure in our congregation that our congregation is healthy. And I know that there's a lot of faith leaders that are looking at how they can provide different programs for their congregants. And I got to the point even in my congregation to where I wanted to make sure that we changed the way, we came together and we shared dishes. If it's not healthy, we're not doing it. But the call to action, for me is, first of all, faith leaders being knowledgeable of your community, your congregation, and understanding that it's okay that if you don't have what you need, to look to other congregations or partner with other congregations that may actually have that. And then also partner together, because when we look at the overwhelming, overarching need within our communities, it's going to take more than one faith leader. It's going to take more than one church. We got to combine our resources together, our congregation together in order to be able to do that. And then two, I think another part of that is being educate ourselves on understanding the dynamics of the health that impacts our congregation. And then I would say 3, have town halls, have other physicians that can come in, have people to come in who can actually be able to speak. And a lot of times it might be right in your congregation. You may have professionals in your congregation, and being able to bring them to the forefront and creating that space for them to be able to have. And then, I'm available. So, if you're watching this and if there's something that you may have heard me say, I'm willing to be able to come to you, share that information, and help you in your congregation and in your community, your city, to be able to provide something similar to what we're doing. And so my hope is that we can reach as many people as we reach, and we can fulfill our duty and our call to be able to help those who are most in need. We have to reach the lost at any cost.
Great, thank you. I think to conclude, what we get from this dialogue today is the pharmaceutical companies were doing our best to develop the best medicines. The healthcare system is doing its best to take care of the patients. And we also want the community, through the faith leaders, to be empowered to also do their part. So together we can help improve the lives of all. So please help me and thank our great partners here today. It's a pleasure to conclude today's discussion. Thank you.